Hi everyone, my name is Anel Annandale and I'm an educational psychologist. In this video, I'm wanting to chat to you about behavioral therapy for children with ADHD. Now, I'm assuming that if you're watching this video, your child has already had an educational assessment and that they've been diagnosed with ADHD, in some cases also called ADD. And that at this point, you've most probably chatted to psychologists, psychiatrists, and probably done a lot of reading as well and a lot of research to try and find how to treat it. And you might have come across research, a lot of research is suggesting that the most effective way of treating ADHD rests on two pillars. Those two pillars are medication and cognitive behavioral therapy. So medication is quite a contentious issue. I feel like we could waste a lot of time just chatting about that, and this is not really the purpose of this video. But if you haven't yet, I would strongly suggest that you check out my video on ADHD medication so that you can have an idea of what it is, what it does, how does it work in the brain. So whether you go the medication route or in some instances, parents will try some of the natural remedies, I think it's important to note that there definitely is a chemical component that needs to be addressed. Then the second component is what I want to chat to you about today, and that's the behavioral therapy. So for the most part, I'm going to chat to you about my own practice and how I do it in my practice, but hopefully for some of you that live further away or that maybe are somewhere else, it will give you an idea of some of the things to look for and some guidance on what to ask if you take your child to another therapist. So I do a 6-week program, and a lot of parents will say to me, why only 6 weeks? This is not something that's going to go away anytime soon. My child is going to always struggle with this. Why do you just do this sort of, 6-week sessions? And the reason for that is that the program, for me, I am not a big fan of long-term therapy for children, and I'm very careful that this kind of program, if done in the long term, can become a crutch. And so your child is then in essence not really learning some, tools to help him through his ADHD. He's actually just relying on somebody else to help with it. So that's why we do an initial 6 weeks sessions. It doesn't mean to say that once the 6-week sessions are over, I'm going to send you out and be like, there you go, now you've learned everything you can. But what we do is when the 6 weeks are over, what we want to do is just for a while monitor your child, both at school and at home, to get an idea of how they cope and where specifically they might still need a little bit of help. And what we'll do then is that in our monitoring, if we see that a child is maybe still struggling with one aspect or maybe something new has popped up, we'll get them in for some isolated sessions, 2 or 3 sessions, work on that intensively, and then we keep monitoring them further along. And so it really looks on the whole, it is a 6 weeks intensive therapy sort of program, 1 therapy session a week, and then little tweaks as they go to make sure that, we sort of keep on the right track with them. And so the how it generally works is that I will do specific work with a child within the session, things that we want him to learn, and then after the session I will contact you as the parents or teacher at the school and then explain what we've done and give you some ideas of how I want you to try and implement this practically in the child's living space, and then also give you some ideas of things that you can practice with the child in those various settings. So very importantly, I think, is that we sort of chat about the expectations for cognitive behavioral therapy before you even start on this process. It's not a miracle. You cannot therapy the ADHD out of a child, unfortunately. And so it's very important that you don't expect that behavioral therapy is just all of a sudden your child is going to be, completely changed and not show any signs of ADHD. Instead, what it is the cognitive behavioral therapy really is all about helping your child to function to the absolute best that he possibly can. So it's really about teaching them the tools that they can use to try and manage their own distractibility and their own impulsivity. For me, this kind of program really has 2 guiding principles. There's 2 things that I always try and keep in mind every step of the way. And those two things are that we want to empower your child and we want to build the self-esteem. Empowerment really is about saying, you can do this. This is what you can do to try and manage these symptoms. We are going to put a lot of other things in place. We are going to have external helps. We're going to have accommodations at school. We'll see what we can do from the outside, but also within you, there is a measure of resource. There is something that you can employ that is going to help with this. And then very importantly, that self-esteem. I think self-esteem in children is always very important. And I don't think you can ever work on it enough. But many of you will also have sort of experienced that children with ADHD often have very low self-esteem. And that can be for various reasons. But sometimes they're only diagnosed after having struggled for a long time. Sometimes they start to realize that they just can't do things as well as their peers, or they start thinking that there's something very wrong with them, or that, they're never going to be able to achieve. And so throughout these sessions, it's very important that both in my interaction with them and your interaction with them at home, we really work on building that self-esteem. We will never, ever, ever say within the child, the therapy sessions, that we have to fix this in you, or there's something that is wrong with you. So the message we really want to get across is, this is how your brain works. Let's see how we can tweak that to work the best for you. Okay. And then the last aspect that I think is very important to mention is that this kind of sort of intervention needs to be customizable, because all kids are so different. Some of them are diagnosed early on, some of them are only diagnosed a little bit later, they all react differently, they all come from different backgrounds. And so we need to be a little bit flexible in the way that we sort of present this program. If you ever come across a therapist that say to you, this is how the 6 weeks work, we stick with that, I would just be a little bit cautious about that. And so what we'll sometimes do is sometimes I will be working with a child and I'll find that some of the aspects he actually really, sort of gets them immediately, that has a lot of success with, does really well. And sometimes there's some other aspects that they struggle with. And so we'll spend a little bit more time in the aspects that they struggle with than the ones that they do well on. Sometimes what also happens is that you'll be busy working with a child, and halfway through this kind of intervention, a lot of emotional stuff starts coming up. And so there is no ways that I'm going to just rush through the rest of that sort of, the therapy or the intervention sessions and just ignore the emotion. And so what we'll do then is, if this emotional stuff comes up, I will call you as a parent or even as a teacher and say, some stuff's come up that I think we need to address first. And we'll work on that emotional stuff for a few sessions. And then once your child is in a better space, we'll carry on with the cognitive behavioral interventions to help him with his ADHD. So in a nutshell, that's basically how the cognitive behavioral therapy works for children with ADHD. Please let me know if you have any answers. I will be very happy to answer them. My contact details should appear on the blog below, but you can send me an email at anal@childpsych.co.za, or simply send us a WhatsApp or give us a call on 082 6959319. Thanks, guys.